Senator Crumley, as your subcommittee has had meetings around the state, have there been any specific recommendations that have come from that the subcommittee yet, or are you anticipating some particular recommendations?
Yes. We've had 5 meetings, counting the meeting last Thursday night. And our first meeting was held June the 11th at what I call Ground Zero. So that was in Phillips County at Helena, West Helena. Then we had one in DeQueen in June, which has a large Hispanic population. Dallas County at Fordyce in October, and then one in Forest City on January 14th, and then one February 25th, 2010 at the Capitol. And yes, there's been a lot of great information that we've collected, and also some recommendations that we're trying to put together. But if you would allow me something of privilege, you mentioned earlier with Dr. Nash about healthcare being personal responsibility. And this is what I would like to say in regards to healthcare, even in these red counties. And we have 19 red counties. And by a red county, we're talking about a county that has from 6 to 10 years less life expectancy than a green county or the best county, which is Benton County. So there are 19 of them. Most of them are located in the Delta. So I won't go through calling the list, but one of the things that we found throughout this, and despite the disparities, a lot of it is tearing down old stereotypes. A community might have an hospital there, but religiously, a lot of the people in the town won't use that particular hospital. And it's because sometimes in the past, it might be 10 or 15 years ago, they mistreated my aunt, they mistreated grandma, and I'm not going down there, so we don't take advantage or use the facilities that we have. One of the things that we have to try to teach people, that they have to get over those things, and they have to move back and use the health care facilities that are there, and then they have to become, the final effort to become healthy is personal. I often open up a meeting by saying that health care is like going to heaven. It's personal. You can have the best church, you can have a beautiful church, you can have the best pastor, the choir can sing like angels, and great deacon board and everything else, but that final commitment to do right and do what it takes to get to heaven is strictly left up to you. So it is with health care. In terms of getting off medication, I can just say, and not to try to boast on it, but last February I weighed 348 pounds. I had a body mass index of 46.4. During that time I was on blood pressure medication. I was also on diabetes medication. I've been off blood pressure medication since last June, and diabetes medication since October. So taking care and getting involved in your own personal health care is essential. It doesn't matter whether you live next to a level 1 trauma center. If you're going to be inactive, you're going to not eat right, you're not going to exercise, you're going to do all the things, then that hospital is not going to make you healthy. So you still, as bad as they are, we know that poverty and a lot of other factors impact throughout, these red counties, but still it's that individual thing, it's that first nudge, it's that first thing that has to start with each individual of saying, well, I just don't want to live like this any longer, because in the end, it's not the length of life, but it's the quality of life that we lead. Thank you.
So take that. Thank you, Senator Cromley, and congratulations to you for doing that. I mean, that's outstanding results. Senator Steele, I know you wanted to talk about some other policies, perhaps, that you'd been engaged in and others in the legislature. If you will take some time to do that, and then after that, followed by your comments, I will introduce Dr. Ron for some comments.
Well, thank you. We've been involved in several, I think, major public policy initiatives, and I say we certainly openly, many of the people in this room played integral parts, and I think in moving Arkansas forward. As I said earlier, it happened over a relatively short period of time, and the way you can really compare and be able to measure what we've done is simply by looking at other states, particularly looking at those other states around us. We never get a fair shake when we're compared in those national polls, but I can tell you that Arkansas is a much healthier state today certainly than it was 20, even 10 years ago, because of the work of many of those individuals right here in this room. I'm often asked about a lot of public policy issues and actual legislation that I have been a part of, either sponsoring or co-sponsoring, and ones who've had tremendous impact, and certainly in many ways I've been blessed to be a part of many who have been a part of even saving lives. I think in this past session, increasing the tobacco tax, that was certainly a courageous move by the legislature and the governor, not only to raise the tax, but to make sure that all the money went toward health care, to help support programs that are in this very facility. I see SIP Malden there, and to support community health centers, rural community health centers, and I know that Speaker Will said that he wouldn't support the bill unless something could be done to help community health centers, especially those in rural areas. And that gives you an indication of how broad you have to think in the public policy arena when you are a public policy maker as it relates to health. A lot of things, particularly economic development and other things, you have to think about your district, those individuals who sent you to represent them. But oftentimes you have to eliminate those borders, those district borders, those county borders, regional borders, and do what's right for the state of Arkansas, particularly when it comes to health care. So we're very proud of that. We're very proud of the trauma system that is in the very near future going to go into place. It's estimated that that's going to save hundreds of lives per year, and it was certainly, I think, monumental that we were able to do that. Not only we don't have a crystal ball in the legislature, but even in these tough economic times, the revenues we receive from the tobacco taxes have been some of the strongest revenues, if not the strongest, that we're receiving in the state of Arkansas right now. We put those revenues in what's called the general revenue pot, meaning that unfortunately when there are cuts, there are even cuts in those programs that are being funded by the tobacco tax. But that money has come in even at a level that we, Dr. Thompson, didn't even expect ourselves. So that